Hi, this is Talia MK at Health 2.0 Conference, Dubai Winter 2022, and I have with me Dr. Liudmila Schafer. She is a medical oncologist, and she is also a founder and CEO for the Doctor Connect. She was awarded for outstanding leadership for her work. First of all, congratulations. Thank you for giving us your time. Please tell us about you and your organization.
Thank you very much for inviting and everything and providing interview. So I'm a founder and CEO of the Doctor Connect consultancy. I'm a medical oncologist, so I'm a physician and I've been in medicine for 31 years. And what I found out that it's a lot of misleading information on the media, and especially after pandemic and so many years, many businesses start speaking on social media, on the internet, on television, in
Any knowledge?
press. Yes, but then they actually experts in certain field or in certain business. However, it's very hard to represent yourself that the public will understand, because it's a lot of confusing terminology and people don't understand the other industry terminology. So what we've done, we created called the Doctor Connect consultancy, where we help healthcare organizations, healthcare entrepreneurs, businesses to provide specific, strategically structured brand narrative that actually understood by the public. So then when patients and other clients, other businesses listen about information, it got immediate attention. It got an immediate command of the business of organization. So it's kind of all-in-one media solution company where we help healthcare organizations to develop those skills.
What are, in your point of view, the solutions to to provide the healthcare organizations better, or to not only for one specific region, as different cultures are around, different nationalities are around, different professionals are around? How can your product can be good for all over the world?
So providing solutions is the most important option to everything in healthcare. So what we do, we actually take the passion of healthcare organization, healthcare businesses, organizations, and we learn about their passion. Like, do you have a passion outside the job? Yes, most of us do. So we actually marry the passion and expertise combined in one, so then your organization will actually be defined rather than labeled. The other solution is to provide value for value. So we have to find out what's valuable to the other clients, to patients, to other organizations, and then if you want to ask something, you have to provide value for value. So those are
Kind of a win-win situation.
win-win situation.
Okay, so as being in such field, I'm sure you come across a lot of clients, businesses. What are the common mistakes you see for the healthcare organization or businesses are doing while dealing with their clients?
Most of us, as we know, we focus on ourselves. So every time we have, let's say, the network, and people start speaking about themselves. So one is to find out something from other person. Was the other person interested? What in the business world, what it means that when we start business or start to develop organization, we try to develop logo or brand color or offers or product. But actually, if we go back and we find out what's interesting for the public and kind of work backward, so that's working backward to find out what actually valuable for the patients, for the clients, and then develop product toward that. So I would say that's one of the mistakes to focus
Okay,
on.
so as your company, does it deal only with one specific region, or is it available all over the globe? And the second part of the question would be, I believe Middle Eastern audience will be different from any audience in Switzerland or Germany. Tell us, what is the one common thing you find in them, and how do you deal with the different nature of different cultures?
One, I'm happy that you brought up about this because one of the products that we have, it's called Global Impact Strategy. We don't want to focus on one organization, on one country, and actually go and develop the network where we unite. And that's where this particular conference comes together, where we have a global impact. So the global impact strategy means we do find out the other side of the business, the other side of the culture, the other side. And one of the options that I have was trying to be, as an example, I wrote a book. It's called The Other Side of Oncology.
I was about to talk about that book. So she is not only an oncologist, she's not only a physicist, she's not just a doctor, she's a bestseller author as well for The Other Side of Oncology, and she have received 8 credits, right? For amazing. So please tell us a little, as you were already talking about it. I wanted to brag about it because it's bestseller for a reason, and I'm sure because she is getting a leadership award as well.
So the other side always fascinates me because we used to label people or just learn from one point of view. So in my situation, it's called high-octane observations from the medical front. So we discuss a couple of chapters like patients needs to have patience and divide into different perspectives. One chapter and it's doctors, another patients, and another one is faith, because a lot of patients bring up about faith as well. So we want to learn about the other side, and it's kind of a strategy toward develop different information around the globe in different countries.
I think being a woman in medicine is a tough job, especially when you have a pedestal to sit on because you have kept a high standard like yours. You're an author, you're a doctor. Tell us, what one advice would you give to newcomers who would want to follow your path?
It actually comes very simple. Interesting that in the United States, it's about 80% of leadership positions held by men. And when we did the research, actually at the medical organizations, a lot of times when women announced by first name. And when a man presented, it always announced as a doctor, and it actually decreases credibility. So we've done research and found out how just naming by women by name and men by doctor, it actually defeats the credibility, decreases the network, and right now in the United States particularly, only 6% of female hold the chair positions. So what I would like to urge everyone for equity and inclusion, and see how we can all work in this. And the moving forward, what I would like to address everyone is just be courteous toward each other.
Amazing. Thank you so much for your time, and I would like to add people and women like you in any field, whoever is looking at you, you are an inspiration for women all over the world. Thank you so much for your time. So being at a conference, Health 2.0, what kind of learning and networking experience you are taking from it? And tell us, if we want to collaborate with you or if we want to take in advice from your end, how can we do that?
Being at Health 2.0 really helped me to find out the other side of businesses. And what's wonderful here, because I was able to connect not only with physicians and healthcare experts, but also with attorneys and people in law, in media and education. So it really brings 360-degree network, and that's what it helps me. So if we would like to help not only in healthcare industry, but if you would like to go from zero in a media to a reputable media, and present your strategically structured brand narrative, be an A-plus expert in the media, please connect with us at thedoctorconnect.com.
Thank you so much for your time. Congratulations. A lot of growth to you. And as she said, it's stereotypical whenever the doctor name or a woman in medicine, whoever is working in medicine, it is a little bit harder road than the male perspective. Let's break the stereotype and make wonders for ourselves and make a name and where you are helping others and helping yourself to make the world a better place. This is Thalia MK signing off, and thank you so much.